Well, hello everyone again. Thank you for joining us. Tonight it's about you and what you can do about your health and what you can do to get the best access to wellness. And to help us do that, as I hand this over to him, is our very dear friend, Joe Woolsey. And I'll just wait for him to bring the slide up. Why don't we go to the next slide, Joe? And I'm going to take it back again. If okay, good, great, excellent. Did you? Okay, hang on a second. Okay,
So there we go.
there you go.
All right. Fantastic. Well, as you can see, I've been studying wellness and nutrition for a long time, and I co-founded a nutraceutical company back over 10 years ago, but now I'm the vice president of business expansion and the co-creator of Wellness Shield. And Wellness Shield is the only wellness-oriented discount medical plan in the country, and it's even so much more than that, really. And so that's what we're going to get into, is what is Wellness Shield and what can Wellness Shield do for you. Now, one of the things, we know that the healthcare system is broken, but we don't know why. Now, if we look back to the 1930s, and the reason we go back to the 1930s is because that's when health insurance became kind of common here in the U.S., okay? So if we go back to that time, and if we looked at the price of common grocery items and apply the same rate of medical inflation to the grocery items that medicine has gone through, healthcare has gone through since the 1930s, today we'd be paying over $80 for a dozen eggs. We'd be paying over $120 for a pound of bacon. And to me, this is possibly the most staggering of all, almost $25 for a single roll of toilet paper. That is staggering. So think about it. Just for the average breakfast, American breakfast, not that it's a super healthy breakfast, but still, bacon and eggs, $200. And then $25 for a roll of toilet paper. Obviously, these prices are completely unsustainable, and that's why healthcare has become unsustainable too. It simply is no longer feasible to pay the kind of prices we're having to pay. And there's lots of reasons for that, but the bottom line is that government can't fix it. If you're waiting on the government to fix it, they can't. Because the real place that the problem lives isn't anywhere the government can do anything about it. The real problem is you and me. And what I mean by that is that we've got to take control of our health and wellness. See, I talk to people all the time, and David, I know this happens with you, Dr. David. I guarantee you've heard this before. Somebody said you talk to them about taking responsibility for their health, and they go, oh, I'll let my doctor worry about that.
All right.
I promise you, yeah, your doctor is not losing sleep over your health, okay? They write the prescription, and they're on to the next patient. They don't have time anymore. Whereas back in the 1950s, 85% of all physicians in the U.S. were primary care physicians, okay? 85% in the 1950s. Today, 15% are primary care. And yet, they're having to see a far greater patient load per doctor than they saw in the 1950s. And so what's happening is the average amount of time a doctor can spend on any one patient, I don't mean FaceTime, I mean the average amount of time they can spend on that patient is about 7 minutes. That's in everything that they do with that patient. Reviewing the chart, making notes, actually in the room with the patient, 7 minutes. It's not enough time. They can't do it. And they've forgotten about what they talked about with you within 20 minutes, because 20 minutes, they're 3 patients down the line and getting ready to go to their 4th. So they've forgotten all about that. That's why they make notes. They may even quite often use voice recognition transcribing software because they don't have time. They can't think about it. They have got to nail it down, write a prescription, and move on. Okay? So we've got to take responsibility for our own health and wellness, and that is a key thing that we've got to understand. So we believe that the answer is in providing quality information, quality networks, quality providers, quality service, but most importantly, it's got to be at a price that virtually everyone can afford, because if it's not affordable, it doesn't matter how good it is, okay? And so we work very hard to put out the very highest quality information. Our website is actually built in the WordPress blog engine, and we put up blog information on wellness. We also have a Wellness Shield Facebook page, so please go to and like our Facebook page. You can easily find us on Facebook in the search right at the top in the middle. Type in Wellness Shield. Remember, it's 3 S's in the middle there, Wellness Shield, all one word, and you'll find us, and please like the page. I post there 2 or 3 times a week, sometimes 4 or 5 times, sometimes 10 times a week. And feel free to like every post, share every post. You know, get this information out there, because it's things that can help people to get healthy and stay healthy. And that's the important thing we're looking for here. Now, we've been around a while. Our founder, Mike Stern, founded what was one of the very first discount dental plans, the first in Texas and one of the very first in the country. He was actually the administrator for one in the very early 80s, then founded his own, Dorsey Discount Services, in 1985, and he helped to create and serve on a state dental HMO advisory board. He is a recognized authority nationwide on dental and medical plans, and we're celebrating over a quarter-century of service, and in that time, we've saved over 250,000 customers, literally millions of dollars. And so we know what we're doing. We've been doing it a long time. But part of what makes it possible for us to do this is we also have some of the best possible allies that you could have in our membership, in our business. So I'll get to those in a minute. But what is Wellness Shield? We're a nationwide membership program, and we offer affordable medical, dental, financial, wellness, lifestyle services. And these can be as a complement to a major medical plan, as an alternative for those without major medical for whatever reason, and as an essential health and wellness program for individuals, families, and companies who want the very best for themselves and their family or employees, and the savings that can be derived from this. And that's the bottom line is we make our plans so good that they more than pay for themselves. So I talked about allying ourselves with some of the best in the business. We're allied with Trotter Wellness, the Dental Access Network, CallMD, PHCS, and Carrington. Some of these names may be familiar to you, some aren't, but they will become familiar to you, I promise you. Now, Carrington is our primary administrative ally. They are the largest discount plan administrator nationwide. They were established back in 1979 here in Texas, but as a dental HMO. And in 1985, they sold the HMO and started a discount dental network, which has grown. But their primary business now is as an aggregator of various medical and wellness-related and lifestyle-related networks and services. And they have a wonderful, high-quality member service center that handles over 75,000 customer service calls a week, and they service over 9 million members here in the U.S. And so that's why we work with them, is because they're the biggest, they're the best, and they can handle a huge call volume. Because as we take this plan nationwide, we intend to double their business in the very short term. And so that's why we wanted to go with them, is because they have the ability to ramp up and have handle large numbers of members. Our primary physician provider is PHCS. They are the largest physician network in the country. They have over 500,000 healthcare professionals. That's both primary care physicians and specialists, and over 66,000 ancillary providers. That includes labs, imaging, durable medical supplies, audiology, including hearing aids, things like that. And so, and the discounts are real, 20 to 45% savings on routine office visits and the ancillary services. The average discount is actually 42%. Those are real savings, okay? One of the reasons that we like this and working with Carrington is they have live operators that are available to assist our members in locating the appropriate doctors, specialists, and services, confirming the appointments and the discounts, which helps our members to minimize their out-of-pocket expenses. And one of the big reasons we went with the PHCS network, not only are they by far the largest network, but they require their members to pass through some very strict credentialing criteria, and whereas some networks will just take anybody who signs up. And so that's why we work with PHCS. And by the way, there are only about 661,000 physicians in the U.S. And so if you'll do the math, that means that right at about 80% of all the physicians in the U.S. are in our network. Very important thing to note. Then we have Trotter Wellness. Now, you probably haven't heard of Trotter Wellness, but you have heard of some of the people that they provide wellness for, and we'll get into that in just a second. But what they do is they provide a single source solution for families and employers through a complete, and I will show you how complete, suite of wellness programs and management services. And some of their results are that they have 82% program participation for members and spouses, a 93% satisfaction rating, 98% retention rate, and they show a reduction of 29% in health claims. And for a business that brings this on for their employees, this can be huge. This can make the difference between, are we profitable this year or not? Do we have enough money to pay bonuses this year or not? Do we stay in business this year or not? And what we find is that their average client will be paying for the program by the end of the first year. In fact, the average is that they're getting about a 2-to-1 return on investment within the first year, meaning for every dollar they put into the Trotter Wellness program, they're actually saving $2 that stay on their bottom line. And by somewhere in the 3 to 4 year range, about 3.5 years, they show an average of a 5.2 times return on investment, meaning for every dollar put into this wellness program, that company is saving $5. And those savings come from the reduction in healthcare claims, reduced unscheduled absenteeism, reduced disability claims, increased productivity. Healthy people produce better. How about that? Healthier people are happier employees. They produce better. And in fact, when companies that use Trotter Wellness as their corporate wellness provider do exit interviews with employees who are leaving for whatever reason, maybe a spouse got transferred or whatever reason, when they conduct the exit interview and ask them, what will you miss most about working here, by far, by a huge margin, like a 5-to-1 margin, the answer is the wellness program. That's what they're going to miss the most. So exactly, and by the way, you'll notice the NCQA certification here. What does that mean? The National Committee for Quality Assurance is the certifying body for health risk appraisals. Why is that important? Because there are tax advantages to having a corporate wellness program in place for businesses of certain sizes. But the number one first criteria is it NCQA certified? If not, it probably won't qualify for the tax incentives. So what do they provide? The Advantage Health Risk Assessment. What this is an online HRA, health risk assessment, that the member takes. It takes about 20 minutes to do online, 10 to 20 minutes. It depends. If you're one of those people that can get online and knock things out very quickly, you'll be done in 10 minutes. If you have to think about it a little bit more and really consider your answers, maybe 20 minutes, somewhere in that range. But instantly after you've taken that assessment, it will generate a personalized wellness profile report. And this report is a 14-page analysis of your health risk assessment that will give you recommendations in the top 14 modifiable health risks that are identified for people here in North America. And it will give you specific recommendations based on your answers and where you're at. And so somebody who scores a 5 on this is going to get far different recommendations from somebody who scores an 85, because they realize they need to meet you where you're at. And Trotter has been doing this for over 20 years, and they grew out of WellSource, which has been doing this for over 30 years and actually was the very first. But WellSource was primarily just a computer program for wellness that was put on a mainframe computer, because this was, remember, 30 years ago, before the Internet. Trotter brought it into the current realm, made it Internet-based, online-based, and included the coaching and other things with it. But this tradition grew out of a health tradition that goes back far beyond that. And among other things, they employ the Adventist Health Study, which is one of the longest medical studies that has ever been done. I believe they're now in their 5th decade, and do a huge study on what works, what makes people healthier, live longer, have lower risk factors. And so the recommendations are based on a long-term look at what affects health and wellness in the population. And so if that was all we offered right there, that could make a huge difference in people's health and wellness. But beyond this, we have their entire wellness web portal, which first of all includes their online wellness center, which has a health activity tracker, which helps people to track their progress. So when you take this HRA, not only does it create this personal wellness profile report, but it also populates this health activity tracker. And over the course of the next year, you can fill in. You can go in daily, weekly, monthly, as often or as seldom as you want, but put in what's happening. Check your weight. I walked 2 miles today. I'm eating better. Whatever it is, you can put that in there and track that. And I think that's a wonderful tool. They also put out a monthly newsletter that's an award-winning newsletter, the Wellness newsletter, and every newsletter includes a monthly wellness challenge. And I really urge everybody who joins us to participate in this challenge. And it may be something as simple as remember to floss daily. That was one of them. And the wellness challenge always, by the way, comes with a printable, separately printable sheet that's kind of a calendar page, if you will, that is about the challenge. So you can record on this calendar what you're doing, and you can put it somewhere that'll remind you. So like if it's a diet challenge, remember to eat more fresh fruits and vegetables, then that would excuse me, that one you could print and put on your refrigerator. The one on flossing daily, obviously that'd be a great one to tape onto your mirror in the bathroom where you brush your teeth. And so they make this where it's easy to do. They have healthy living guidelines, and what these are is videos that will actually take and show you how to integrate a wellness lifestyle into your daily routine. And even for those of us who have very healthy lifestyles, I've learned tremendous things from them. And one of the things I'm most excited about is the lifestyle change modules. These are online modules that are virtual coaching, and they have coaching in smoking cessation, in weight loss and weight management, in stress reduction, in blood sugar modification, in drinking modification. And so hundreds of thousands of people have used this to increase their health and wellness. And like I say, it's online, virtual coaching that'll track your progress, reward you for your progress. And to me, that's wonderful. And then the final thing here, the discounted optimal health coaching. This health coaching that they have can can be sold actually wholesale to companies for anywhere from $160 to $500 a year per person. we make it available for $129 a year per person. That is simply outstanding. To be able to, for $129, talk to a professional on the phone who will help you with every step of the way in achieving your wellness goals. To have access to a professional who can do that and who does it on a daily basis with tremendous results for $129 is simply staggering. That you can't imagine how good that is. And I mean, I know people that pay over that just to see your average wellness coach one time, and this is for a whole year of access to these health coaches. So that's great. By the way, everything in Trotter is available to for our memberships are for all members of household. Everything that Trotter does is only for adults, so 18 and older, but everyone in your household that's 18 and older will have access to all of this, and will be able to log on and maintain their own profile and do everything. And so to me, again, that's a tremendous value. And every member of Wellness Shield gets access to Trotter Wellness. Now, like I said, you may not have heard of them, but you've heard of some of their clients. They are the wellness. Remember back during the healthcare debate, and people were saying, well, why didn't Congress just make their plan available to us? Because they've got this Cadillac, state-of-the-art healthcare program. And one of the best parts about it that they were bragging on was their wellness program. Well, Trotter Wellness is the wellness provider for the U.S. House of Representatives. Not only that, they're also the wellness provider for the CIA, the National Security Agency, the NSA, the Coast Guard, and the Pentagon. So if you're concerned about whether or not their website is secure, I think you can put those fears to rest. They're also the wellness provider for Johns Hopkins and Vanderbilt. Those universities have two of the top medical schools in the country. They could certainly create their own wellness program, and yet they turn to Trotter Wellness. Blue Cross Blue Shield Association of California, Concentra, Kaiser Permanente. These, again, are companies that you would think could easily create their own wellness program. And in the case of Kaiser Permanente, they're the ones who invented HMOs. And yet they're saying, this is what works. We're using this for our own people. Cooper Health and Aerobics. Dr. Cooper is the gentleman who invented aerobics when he was the fitness instructor at the U.S. Air Force Academy in the late 50s, early 60s. If anyone could create their own wellness program and has, it's them. And yet for their employees, they turn to Trotter Wellness. And what that tells me is when the experts go to Trotter, when the experts go to them, then they're the experts. And that's why we use Trotter Wellness. We believe they are by far the premier wellness program in America. And again, we are the only way that an individual, a family, or a small business can have access to their full line of services, and at an amazing price. We also have CallMD. Research shows that 70%, up to 70% of all doctor visits could be handled by a phone call. CallMD is, we believe, the premier phone-based physician service in America. There are about 4 of them out there. Some of them get into trouble with various attorneys general. One of them, in fact, Dr. Ajibade is in Oklahoma. One of them was kicked out of Oklahoma. We didn't want to do business with any like that. We chose CallMD for a number of reasons. One of them is when you call their 800 number, you're instantly talking to a nurse. With most of them, you're just talking to an operator. With CallMD, you're instantly being triaged. They're assessing you and deciding who will be the best doctor to have call you back. They will tell you that they're going to have the appropriate doctor call you back within 3 hours. I've never heard of it taking longer than 45 minutes. And here's a great one. If you say, well, let's say you call and it's 11:30 and you're getting ready to go to lunch and then you've got a meeting, you can say, you know what, I'm going to be to lunch and a meeting. Is there some way the doctor could call me back between 2 and 4? They'll schedule the call. When's the last time an MD called you at your convenience? To me, that's amazing. And plus, one of the things is I want you to know right now that if you go to the CallMD website, their family plan to cover all members of household is $19.95 a month. I want you to remember that number, $19.95 a month. And you pay $35 per call right from the beginning. Wellness Shield members get 12 free calls per year and then pay the $35. David, is that an amazing deal?
That is amazing. And did I hear you right when you said that you can get the doctor to call the person back?
At their convenience, yes. And I've actually done that already where I said, you know what, I'm not going to be available for this block of time. Can they call me back during this block? And they did.
And a doctor called you back?
Yes.
That's almost unbelievable.
And of course, and they're able to prescribe when appropriate as long as it's a non-narcotic. Now, it's important to understand that even if you saw your personal physician this afternoon and then called him an hour later and asked him to call in a prescription for a narcotic, he cannot do it. It is against the law. He will lose his license. He'll lose his ability to prescribe. That prescription has to be placed directly into your hand by the physician. So these physicians can prescribe anything your doctor can by phone. And like when I did it, they said, well, we see that you're at this address in this zip code. And I said, yeah, but that's my home. I'm in this zip code for my office, and I go to the Walgreens that's right around the corner from me, and they said, oh, is that the one at this address? Yes, it is. And they called it in there. I lost 0 productive work time.
Wow.
Okay, whereas I don't know about you, but I'm really lousy at scheduling when I'm going to be sick. Okay, and so what happens is you call the doctor's office, right, and they say, "Oh yeah, sure, come on down, we'll work you in." Well, I don't know about you, but that's 4 hours out of my day gone between when I make that call and go, and when I'm done with that. I could wait 2.5 hours in the waiting room easy, another 45 minutes to an hour and 15 minutes in the examination room, finally see the doctor for 5 minutes, okay? Then I go take the prescription to the pharmacy, wait another 20 or 30 minutes there. I mean, easy, 4 hours gone, right? Whereas with this, let's say it's something like, this is a very common thing, especially here in Houston, the allergy capital of the world, sinus infection. It's bad enough to where you need that prescription to knock it out, but not bad enough to where you want to miss work, okay? So you take this call, you do this, they call it in, you go at lunch or on your way home, you haven't missed any work, you haven't lost any time, you are productive, your boss is happy. If you own a company, this is a productivity tool. Not only this can cut down on some of the most expensive health claims that you can have, whether it's for you and your family or as an employer, because these can eliminate some of the urgent care and emergency room claims they're going there simply because it's after hours, but those are very expensive claims that could be handled with this service. This is an amazing cost-saving tool. It's a productivity tool, whether you're looking at it from your own productivity to where you don't want to miss work, don't want to miss time from work, or maybe you own your own business. Time away from work is obviously money lost. Or if you own a business, providing this for your employees can be a tremendous productivity tool. This alone can increase your productivity a tremendous amount. How do you think about that, David?
That's amazing. It's just amazing.
Then we also have, I'm sorry, go ahead.
I said it's amazing. That's just amazing.
Then we have the Aetna Dental Access Program. This is the premier dental plan in America. We have over 80,000 dentists. Our members save an average of 15 to 50% on everything in dentistry. There is nothing that isn't discounted, okay? Because after it goes through the entire fee schedule, then it says, and everything else is 25% off. Okay? So the reason we went with that, now, like I said, we have our own small local Texas network, but we wanted one that matched us nationwide. And this one is the only one that does, and here's the great reason why. They don't have any gotchas in their plan. What do I mean by gotcha? What I mean is this. You may find, you'll notice that things like this crown with high noble metal, the average cost, and these are regional fees averaged in LA, Orlando, Chicago, New York City. It can vary. The member cost there, $597. You may find a plan that may have a price of $480. Okay, that's come on the low end. But if you read the fine print on theirs, that price does not include lab fees. This price includes the lab fees. Okay, so what that means is the $597 includes the lab fees. You're not going to get hit with another $300 or possibly even more in lab fees. That's a gotcha, and I've had that happen to me a number of years ago where they said, oh, well, your price is only going to be this much. And then when I go to pay the bill, it was $1,000 more. And I'm like, where did that come? Oh, well, that's the lab fees. That's a gotcha. This plan doesn't have the gotchas, and that's why we use this plan. The real cost on this one will beat any of those so-called lower cost plans because no gotchas. That's huge. And I know it says over 76,000. Excuse me. I should have edited that. It's now over 80,000. In fact, I believe it's over 82,000 dental practices nationwide. So it's a huge, huge network, and the savings again are real.
And this is in all 50 states?
Actually, it's in 47 states. We are not allowed to do this in Washington State, in Montana, and Vermont. Basically, Washington has just recently socialized medicine, and including dentistry, and made it to where there's virtually no way we can offer this there. And in both Montana and Vermont, they have kind of interesting laws. What they did was they said you can't sign somebody up for a dental plan unless there's a dentist within 5 miles of where they live. Well, in Vermont, they so heavily restrict the number of dentists that they'll license in that state that there's no way you can have a dentist within 5 miles of somebody's home. And in Montana, there are people who live on a ranch. The dentist would have to live with them and have their office in their house because they may be 80, 90 miles from the closest, mom and pop store, much less dentist. And so there's just no way for us to do business in those states because of those laws. But otherwise, yes, we're everywhere else, including the District of Columbia. So 47 states and the District of Columbia. Thanks for asking me that.
So most major cities would probably have
Oh, absolutely. Absolutely. And we have, there's a lookup online at the website, and where people can look up, find dentists, find specialists, find everything.
Gotcha.
Absolutely. So that's the Aetna Dental Access Program. We also use the iMed Vision Care Network. Quite often, if you have a major medical plan, say through your employer, they may offer dentistry but extra. They may offer vision but charge you extra for it. Or they may offer a very basic vision plan. Quite often, if they offer a high-end vision plan, it is iMed. They've just rolled it into the major medical plan, even though it's really just a discount plan. And if you read it carefully, quite often it is just a discount plan. It's even though it's rolled into a major medical plan. But this is a little bit different, is because even then, about 95% of the time, they don't include LASIK or PRK or replacement contact lenses. We give you the full ride, the full boat. Everything's included. And we pay extra for that, but we want our members to have everything. And on our laser, we even pay even more because we've done it to where even if the provider is giving a special on their LASIK or PRK procedure, our members get an additional 5% off the promotional price. And so you always get the best possible price again. And so the iMed Vision Care program is truly excellent. Over 40,000 providers, and that's including optometrists, ophthalmologists, opticians, and dispensing locations, such as LensCrafters, Sears, Target, JCPenney, Pearl Vision, etc. So again, a tremendous service here, and for all members of the household. I think that's a pretty amazing thing. And then our prescription drug program, again, we don't recommend prescription drugs, but there are times when they are appropriate, and at those times we want you to get the best savings possible. And again, our members find that usually our price beats even their major medical plan if they have one, and certainly if you don't have one, then it really beats it. And it's available at over 53,000 pharmacies nationwide. Now, I want to tell you, too, you'll see these free prescription drug cards out there, free prescription drug discount cards. Usually those discounts average 15%, and the reason they put that free card out there is because the person who made those cards available is getting a commission. Those commissions can run 15 to 30%. Okay? That's what's going on there. It's a racket, okay? When we negotiate, since our whole thing is about taking care of our members, we negotiate the best price for our members. And toward that end, we have just added a new mail order program, so if you're taking something on a regular basis, you can get even greater savings with our mail order program, 50 to 70% savings, and we were told that the average saving is over 65%. And so, like, here's a few, well, as a matter of fact, we had somebody recently who was quoted a price of was given a prescription for Plavix and told, you need to take this. They just had a mild heart attack. Well, the average nationwide price on Plavix for a 30-day supply is $215, okay? Through our mail order program, they saved $170 a month. That's over $2,000 in savings a year on one thing. That's amazing, okay? So the savings are real. Again, we don't advocate, taking drugs for everything, but there are times when they're appropriate, and at that time we want our members to get the absolute best price possible.
That's pretty impressive.
So one of the things that comes up with discount plans, and I've heard this a number of times, people say, well, Joe, I was with a discount plan, but they just didn't have enough providers. Well, we've got about 80% of all the physicians in the U.S., plus the ancillary network of over 66,000 providers, plus over 80,000 in our Aetna Dental Access Network, over 40,000 in the Vision Network, over 53,000 in the Prescription Drug Network, plus in one of our options, you can add a chiropractic and alternative care medical network of 11,000 plus, and our lab network has over 2,500 locations. That's over 250,000 provider locations to serve our members nationwide.
You mean?
I think that's
staggering. You mean 3/4, right?
I'm sorry, yeah, 750,000. 750,000 provider locations. So I don't think we have to worry about having enough provider locations. So what's the plan? Well, this is the whole plan right here. For the Essential Wellness Shield, you get the Aetna Dental Access Network, the CallMD Physician Hotline, the Trotter Wellness Program, the Prescription Drug Program, the iMed Vision Care, all of that for $19.95 a month. Now remember what I told you about the CallMD? That by itself is $19.95 a month if you go to their website, and you'll pay $35 a call from the beginning. It's like we're selling you the CallMD and giving you the dental, vision, prescription drug, and wellness programs at no charge, and throwing in the 12 free calls a year.
Wow.
Yeah, that's a wow. I really think so. Plus, for those who do not have a major medical plan, then we include the PHCS Physician Network so that they can get discounts on when they go to see the doctor. And we include our laboratory discounts, which includes this panel of almost 50 tests, one per member and a second adult, free per year. And David, as you look at that and see all those panels, I'm sure you'd agree with me that that could cost you anywhere from over $225 to, depending, like if you were to go get this done through a, quote, executive checkup once a year through one of the premier diagnostic locations here in the U.S., they may charge as much as $2,500 for that same group of tests.
Mm-hmm.
That alone is a staggering discount. Plus, we give additional savings on virtually every type of medical lab work done, and the savings average 50 to 85%. Typically, what I find most of it is in the 75 to 85% range savings over the national average. And you get to order the test yourself, go get it done at LabCorp, so it's not like you're going to some lab you've never heard of. It's LabCorp, and then within 24 hours, the results are emailed back to you, faxed back to you, or put in the U.S. mail back to you, your choice. You control who sees it. You get it back. And so that way you have control over what information goes on to your Medical Information Bureau file. That's also important because that MIB file is becoming more and more important towards many things, including even what your credit score will be.
Wow.
Because they're now sharing information with the credit bureaus. And so let's say that you go in for a checkup and the doctor sends you for all these tests, and he goes, oh, your cholesterol's high, ding, and your blood sugar's high, ding, and your blood pressure's high, ding. You just got 3 dings on your credit score. Wouldn't it be nice? Yeah, how fun is that? And they're going to put you on drugs for all that, right? And some of those drugs have very unpleasant side effects, okay? And the combination of the drugs accelerates all of the things. Wouldn't it be nicer to use this program, go find out on your own, and then go to one of our wellness providers, get it handled naturally, then go get just the test that came out bad redone, find out that it's good, and carry those tests into your doctor. Hey, doc, I just had these done the other day. What do you think about them? Oh, wow, your blood pressure's great. Your cholesterol's great. Your blood sugar's great. Fantastic. And that's what goes in your file. Isn't that a lot better outcome?
This is fascinating, Joe. Fascinating.
Isn't it?
Now,
Okay.
let me ask you this. So 1995, and that covers the entire household.
Whole household for the Essential Wellness Shield, and then for $15 a month more, they can add the entire physician network, the entire lab services, including that full, complete, free annual study, plus the other savings on the lab, plus the chiropractic and alternative medical network. That's another $15 a month. So they can get all of it for $34.95 a month, or they can just get the Essential Wellness Shield for the CallMD, the Aetna Dental Access Network, the iMed Vision Care Network, the prescription drug, and the Trotter Wellness. That's $19.95 a month. But either way, it covers all members of household.
Is there any limit to the number of members per household?
No. As long as they all live at that address, there is no limit.
How about
one other thing I want to touch on, David, is when we talk about the PHCS Physician Network, one of the things that I think I want to briefly mention here too is that for people who have conditions that are excluded, where they can't use their major medical plan for this because they go, oh, no, that's disallowed, you can't use it for that. Well, they can then add our medical and prevention services option and get the discounts then that they need it for. And that's, if you saw the promo video that I did, I said quite often there are families that are paying $20,000 a year or more for their major medical plan, and often the main thing that they needed it for, say for one or two or maybe even all of the members of the household, is completely disallowed. They can't use it for that. Like, let's say that everyone in the household has diabetes, and so anything that their major medical plan decides is related to the diabetes, they get nothing, they can't use that major medical plan for. Well, they can use this, okay? And not only that, we can help them to get their blood sugar regulated, and they can go get regular A1C tests done at a very low price, and when they establish a history of normal hemoglobin A1C tests, then they all of a sudden can get regular insurance that doesn't have any rating on it that says that they can't use it for their diabetes because they're no longer diabetic. How cool is that?
Yeah. Wow.
So the power of this is truly amazing. And like I said, let's say that all you did was use the Call MD 12 times a year. The 1995 easily has paid for itself, easily, many times over, okay? Let's say that you got busy with the Trotter Wellness program and really used it and got yourself even more healthy to where you didn't require any prescription drugs. And let's say that you used the Vision Care program every year to get your eyes checked at a discount and got glasses at a discount. Okay, and let's say that the few times that you might need a prescription, you got like a 60% discount or better. Like I said, we make wellness affordable. Our plans don't cost money. They save you money. They more than pay for themselves every month. I will tell you this, everyone who's ever gotten our plan and gotten the Call MD and used it calls us up and tells us, I will never be without this. We had a gentleman who the Friday night after Thanksgiving, he has 6 children, and the youngest is a preemie. He's 14 months old. He developed an upper respiratory infection during the night. This had happened to him once before. They had to wake everybody up. Everybody goes to the emergency room. Nobody got any sleep. It cost him $1,200. This time his wife reminded him, hey, we've got that Call MD. This is the Friday night after Thanksgiving. He called. The doctor called back in 40 minutes. Bottom line was, between the time that they heard on the monitor the baby was not breathing well, and by the time he got back with the prescription from the all-night pharmacy, he lives here in Houston, so that wasn't hard to find. It had taken him a little over an hour and a half, but the total cost was $30. He didn't pay for the call, and he got the prescription at under half price. The previous time, the ER cost alone had been over $1,200. He'd paid $60 for the prescription, and nobody got any sleep.
Wow.
Yeah.
No, that's
He said, I will never not have this program again.
That's priceless, Joe. That's priceless. Now tell me
priceless, exactly.
Now tell me this: how I mean, it's for you to be able, for your company to be able to do this. How do you keep them going under if you're providing this kind of a discount?
Because here's the thing, we're not paying anything to the providers. But why would they do this? Because they have empty chairs. They have time when they don't have anybody there, okay? We've been doing this for dentists for over a quarter century, and we know it works. The dentists like it because it keeps them full, keeps them busy. Because if they have downtime, they're having to pay their staff, they're still having to pay the rent, they're still having to pay for the electricity and everything else. And so this keeps them busy. First thing. Second thing, though, they have huge overhead associated with that major medical plan. Okay? You know, when you're there, you see all the staff that they have and all the files that they have that are associated with maintaining all the paperwork and administrative costs of that major medical plan. With our members, they just give the discount and that's it. No administrative cost. They wind up making about the same amount of money with a lot less hassle. And our administrative costs are less too because we don't have to handle any claims. We just make sure that the customer gets their discounts. We make sure they get their fulfillment book. Our administrative is less. The doctors, the providers' administrative is less. Everybody has less administrative costs. And as David, I know, as you well know, doctors are paying huge money in administrative costs on their major medical plan.
Right, right.
That's a huge, huge chunk of their overhead. With us, they don't have that. There's no overhead to being with our plan. That's why they do it.
Wow. I see. Okay, tell me this, Joe. Okay, my chiropractor obviously runs across many people who can't pay for their chiropractic help, even though they desperately need it. Would this be something that a chiropractor himself or herself could sell? Could make
Right. In fact, quite often what I tell providers is, look, why don't you become an agent? And they're, we're always looking for agents, and some of our agents are provider agents. We're like here in Texas, we're a licensed DMPO, discount medical plan here in Texas, and y'all can all see all of the required disclaimers there. And outside of Texas, we utilize the Carrington DMPO. There are about 36 states that require some form of licensure or regulation, and Carrington handles all that for us. Again, that's why we use them for our primary administrative ally. And so, like here in Texas, somebody can become part of our chiropractic network, or even here in Texas, or certainly in any other state, we put them in touch with our nationwide chiropractic network. They'll get referrals through us and through other places that are carrying that particular network as access to that, and they give discounts. Now, one of the things that happens is I'll talk to a naturopath or a chiropractor, and they'll say, Joe, I can't possibly give any greater discount. I'm already charging too little as it is. And what I say back to them is this: well, what you're really telling me is you're giving a discount, but you're giving it to everybody. And they stop and go, well, yeah, okay, you're right. I go, look, why don't you go back through your fee schedule, determine the prices that you'd really feel much better about charging, make those now your regular prices, but tell your clientele, if you become a member of Wellness Shield, I'll still honor the current prices. That will become your new discount price. So now certainly the client, the patient, has the ability to become a member of Wellness Shield and get all these other benefits, which are tremendous. They get all of the other services, the other networks. They get all of that, more than pays for itself, and they get to keep the lower prices at this provider that they already like, already love, already use, okay? And one of the things we also can set up is to where they can make this this client, David, you well know, some of your best clients are some, and who send you the most business, referrals, are also some of the ones who can least afford your services. Is that true?
It is true.
Okay. Now you can tell them, hey, I can make you a referral agent for me, and they can literally become, we'll sign them up as a referral agent, and so when they refer somebody to join Wellness Shield, we will actually pay them a referral fee that's 100% of the, let me flip to the next page here of the application. You'll see there's a $25 one-time processing fee. We could actually charge much more than that. Some states allow a lot. Some states don't allow. Florida only allows 25, and we decided we weren't going to do what most of them do and charge whatever the maximum is in every state. We decided to make it a flat rate, $25 in all states. Okay? Well, for a referral agent, we'll actually pay them a $25 referral, but what we do is we give them a $25 gift card. Okay? They get a $25 referral fee, and then the provider agent will get a 5% override on that, and they'll get the customer, they get the commissions, they get all of that, and so it's a win-win for everybody. Your person who's giving you referrals now gets a benefit for giving those referrals. He gets a referral fee that we pay, okay? The provider doesn't have to pay it. We pay it, okay? They become a member. They then get the discounts there. They get all the other discounts. I think it's a win-win-win.
Right.
So this is the entire application. It's not. It's. You'll notice you don't have to put in a Social Security number because, again, we're not a major medical plan. This can even be sold to people who are, how shall we say, not citizens. But it's very easy. We can do this on a credit card. We can do a bank draft. We can do it on a debit card. Plus everybody, it can be discontinued at any time. And as you can see, let's see, we can go back here. As you can see here, it can be discontinued at any time. If you discontinue it in the first 30 days, there's a money-back guarantee for the first month's periodic fee. As you can see, we make it very easy, very simple. The one thing I do want to say is that since we are here tonight on the, it is the 16th, isn't it? Yeah.
Yep.
We do need to have any applications, and you can go online. I'm about to bring up David's website. You can apply online, or you can call us, but we do need to have your membership in by the 20th of the month in order to have a first of the following month effective date. And the reason for that is that we've got to have time to get all your information, put it into the right format, to upload it to Carrington or whichever other provider it is, and then Carrington may have to upload it to somebody else. And so all of that has to be handled before the effective date of the first. And so I would recommend that anybody who's thinking about this needs to kind of make up their mind within the next few days. You've got over the weekend. Really, by Monday morning would be preferable. But as you can see, oh gosh, did I? Yeah, there we go. There's the website for signing up. And you don't even have to type in the http://. You can just start out with secure.wellnessshield.com/reps/Dr. David. Or if you have more questions, you can call us at 800-880-4343. We'll be more than happy to answer all questions. We'll be, thrilled to do whatever you need us to do. We'll email you out an app if you want to fill it out and fax it back into us. We're easy to work with, and we're happy to help. And so I'm going to leave this slide up for a little while, and so people can have time to write down the website and the phone number. But we've been doing this, like I said, for over a quarter century. The Wellness Shield part of it is brand new. But like I said, that's because it is a wellness-oriented, nationwide discount medical program. But I believe it is the premier program in the country. We are a fit for individuals, for families, and for businesses of any size, anywhere from 3 to 30,000 to 3 million. We can handle it.
That's amazing. Now, Joe, we do have some people calling in, so they may not be able to see the screen.
Okay, if you can't see the screen, I'll give you the number. It is 800-880-4343. That is 800-880-4343, and that's during normal business hours, Central Time. And so if you can call, or you can call and leave a message, and we will call you back. Please make sure you say the number very clearly when you leave the message. And also probably a good idea to let us know when would be a good time to call you back, and maybe give us more than one number. And again, the website, you can just type in the address bar, secure, S-E-C-U-R-E, .wellnessshield. Remember, there's 3 S's in there, WELLNESSSHIELD.com/reps, that's R-E-P-S, /DRDAVID. So that's secure.wellnessshield.com/reps/DRDAVID. Okay? So, and if you call, also do please identify yourself as a Building Strength webinar participant, so we can make sure that you get handled properly. And again, that 800 number is 800-880-4343.
Well, this is just fascinating, and thank you so much again, Joe, for being willing to
it's my pleasure.
Work with us on this and provide this information. There are some questions that have come in that we'll ask about.
Sure. It's
but
part of
really,
why I'm here.
But really, I'm looking at this and knowing the people who just need this kind of information. I guess I'm going to make an executive decision. We hardly ever do this, folks, but we will send this link once it's downloaded onto my PC. I'm going to send this out to everybody on our. We have close to 10,000 people on our list right now. We'll send it to everyone so that people can take a look at it and see if it's a plan that's they need, or I don't see why they wouldn't need it, unless of course I can see some people on our list here who.
If you're independently wealthy,
yeah, I can see some people. I can see some people on our list who may not choose it, but then again, they may.
Yeah, if you're independently wealthy and are in perfect health, and but David, you know as well as I do, there are people who'll say, "Oh, I'm in perfect health,"
yep.
And then you find out that they're on blood pressure medication, they're on a statin drug,
right.
They're taking. I've had them that tell me they're perfectly healthy, and they're on 5 to 10 medications daily. When did that become perfectly healthy? I'm sorry, that's not perfectly healthy.
Well,
okay.
We had one person, a big shot lawyer, come in, and he said, well, he's in good health. His doctor told him that every person over the age of 50 must be on this statin medication. I mean, that's just common sense. So I mean, he's like, well, there's nothing wrong with me. It's just that I'm 50 years old, right? So I have to be on this drug.
That's ridiculous. That's unbelievable. I'm sorry, but I'm sorry. A doctor who does that is guilty of malpractice. So I'm just going to state that right up front.
Yeah.
Okay.
Yep.
And in fact, somebody who's oops, I got a little carried away there apparently. Somebody who's very near and dear to me is an MD, and who told me that in fact doctors claim they do what is called evidence-based medicine, and she told me that the outcomes for women on statin drugs actually shows a higher death rate. They're more likely to die from the very issue they're taking it from than not.
Wow.
Yeah, and so to me, I'm like, okay, so any doctor who prescribes that, that's malpractice. I mean, there's no other way around it. So
it's just that. Okay, we have a couple. Acupuncturists. Are they?
The Alt Med program has acupuncturists, has massage therapists, has all types of other alternative medical providers. And in fact, it's a very easy process. If you've got somebody who you want to be part of that plan, you can nominate them. We'll make sure that they're put in touch with the group that has the network. They can join the network. It'll certainly be worth it to them. And we're helping them to grow their network nationwide. Here, David, I'm going to get into a little bit of philosophy here.
Okay.
And part of what this is, I look around and I look at the stranglehold that allopathic, or what some people refer to as traditional medicine or healthcare, has on America, and is part of the reason that we have this horrendous healthcare crisis. And part of what I see is that they've been able to exert this power because they are networked. The major medical plans are networked with the hospitals, are networked with the doctors, are networked with the pharmaceutical companies. It's all networked. I'm trying to do the same thing for natural health care. Create a network of natural healthcare providers and services and network all of it so that we can have the same level of clout. And it's going to take some time, but we have to get started somewhere. This is my version of building strength. The way we build strength in natural healthcare is by banding together and forming a network rather than all operating independently. And so we've got to get this network mentality so that we can band together so that we have some power.
Right. Wow. Wow. And what power that would be, because there's a rising tide now in the whole wellness.
Absolutely. And so I really think the time for this is perfect. And I don't think we could do this at any better time. Obviously, the price is outstanding. You can pay many times more for a lot less.
Right, right, right. Okay, Beth wants to know, if you have a major medical insurance, is the main benefit of this discount program the wellness prevention program and the MD call-in feature?
Well, certainly it is. Plus, you can have major medical that doesn't include dental or vision. And, you know, what they're telling us now is they're finding that many of the chronic health conditions that Americans face now, especially as we age and get older, you know, things that have to do with like arthritis, heart disease, they're finding that a lot of that has either its genesis or is made worse by infections and other things that exist in the mouth. Because whatever you've got going on in your mouth is systemic. It's going to be throughout your entire body, right?
Right.
And so excellent dental care and having a healthy oral cavity is essential to overall health and wellness. So ignoring your mouth is one of the best ways to ignore your overall health. Okay?
As a matter of fact, we've had one of the best dentists, according to Cambridge, in the world do a couple of presentations for us.
Right, I've seen that. And biological or holistic dentistry is something I highly recommend. Mm-hmm. And so excellent dental care is a key component of excellent wellness.
Absolutely.
And so A, there's that. B, vision care. Vision care, I mean, glasses can get expensive. And so 20 to 40% discounts can be significant, okay? The contact lenses can be very expensive. Again, having the discounts can be very significant. And so, and then, like I said, there are people who have their major medical plan but have things that they are disallowed from using it for. They can have this to get the discounts on that area where their major medical is disallowing them. Does that make sense?
Yes, indeed. Indeed. Wow. Wow. Okay. DM.
And you know what? I want to address something else that usually is the follow-up to that. And people say, okay, well, Joe, well, what about the healthcare reform? If that, you know, if and when that takes place, what does that do to you? Well, obviously, we wouldn't have the PHCS anymore. PHCS will go out of business because every doctor will be a member of the national network, okay? So we would probably lose that. But otherwise, everything else remains the same. You could still use the direct labs. You'd still be able to use the dental, vision. All of the rest of it would still be allowable. Plus, for those that are on Medicare, not every prescription drug is part of the Medicare formulary. I talk to people almost every day who tell me, Joe, I'm on this drug and it's not on the Medicare formulary. And I'm paying X amount of money, and I find that I can save them tremendous money. Sometimes I've had people that just on the one drug, like I told you, save hundreds of dollars a month, okay? And so that alone can be huge. Plus Medicare and the proposed major health care reform doesn't address dental. It doesn't address vision. And it doesn't address wellness, okay? And all of those things are crucial components, and if you want to live the healthiest, most vibrant lifestyle you possibly can, all of this would be important to that.
Makes sense. Makes sense. And you say anyone can become an agent?
Yes. Yes, again, call and you can talk to me. I am the Vice President of Sales.
Okay.
Our 800 number, 800-880-4343. Or I'll also give my email address, which is joe@wellnessshield.com. So just joe@wellnessshield.com. And you can email me and just tell me that you heard me on the Building Strength webinar tonight, or just say, Joe is on the webinar, want some information about your plan, or want to be information about being a referral agent or being an agent, or if there are any providers who are interested in becoming a provider agent. Just let me know what you're looking for, what information you want, and I'll take care of it.
Fantastic. Okay. I'm sure you've heard this question asked several times. Nutritional supplementation, how do you get coverage where that is concerned? I would imagine that would be difficult.
Yeah, it is. It's problematic, but we are actually working with some entities who we are trying to develop what is essentially a medical, basically a way to create an across-the-board plan for getting significant discounts on supplements. Now, we do have some things that we have available to us right now, and for those things I can get you that information immediately. So the best thing to do again would be email me and tell me what it is you're looking for, and I can also handle that. But we're working on developing a nationwide discount program for excellent, high-quality nutritional and nutraceutical products.
Wow.
And wellness products. That is in the pipeline for developing a nationwide source where all of our members have access to excellent discounts on excellent products.
Wow.
So watch this space. Check out wellnessshield.com. Go to Facebook.com/wellnessshield, or just go on to Wellness Shield and do a search or go onto Facebook, do a search for Wellness Shield, and like our page, and you'll get every update on your wall.
I would like to see how you pull that off, Joe.
We're working on it. Well, the thing is, David, as we get more and more members nationwide, that gives us more power and control, and it's negotiating leverage. It gives us more leverage.
Right, right. Well, that makes sense. That makes sense. My goodness. Okay. To round up, because I'm going to send this out with some notes now. So to round up, and now we know, like you mentioned, there are some other companies that are doing something like CallMD. So CallMD is not the only one doing what they're doing, obviously. And then there are other companies that have this network with maybe chiropractors and the pharmacists and all that. Tell me in 3 or 4 major points what separates Wellness Shield from everyone else.
Well, CallMD, through anybody else, you're going to pay $19.95 a month. You might get, I have heard of a couple of programs where you can get 2 free calls a month. Nobody gives 12, okay? And for that same $19.95 a month, you don't just get CallMD. You get CallMD and the Aetna Dental Access Program and iMed Vision Care and the best prescription drug plan out there, and Trotter Wellness, the premier wellness provider in America. Nobody gives all of that for that low a price. Nobody.
Wow. Wow.
The bang for the buck on this price is staggering. If you were to, you can go out and buy, you can find Aetna Dental Access as low as, I think you may be able to find it as low as $9.95, but usually that's an individual price, but I believe there's a couple of places where you can find that for a household, okay? And there's places where you can find iMed Vision Care for around that same price. And but put that with CallMD, there's no way. There's no way. Right there, you've paid a lot more. And with the CallMD, you're going to be paying $35 per call from the beginning. Okay?
Okay.
So 12 free calls, that right there saves you $420. Okay? 12 free calls. You may never have to pay for one of their calls. Next thing is you're getting the the vision care. You're getting the Aetna Dental Access Program. All of that. For all of it at that price is a staggering benefit. And that's one of the reasons I show that slide with our founder, Mike. Part of what makes us unique is by having him. You've seen the Priceline commercials where William Shatner is the negotiator.
Yep.
Well, he's got nothing on Mike Stern because Mike's been in this industry so long that he can negotiate better than anybody else. In fact, we had a new guy who got assigned to our account with one of the programs we carry, and so he called up telling us he was going to have to raise our price. By the end of that phone call, he had dropped the price. Okay? And he was like, man, I should have never made that phone call because Mike is the best negotiator in the industry because he's been doing it for so long that he knows better than anybody he's talking to what those actual services and networks are worth and what the right price should be. He tells them, here's what I'm willing to pay you, and invariably they agree.
That is amazing. You know, Joe, I think we probably may have done ourselves a disservice by the title of this webinar. We should have, I mean, the title doesn't really do justice to what you've put on display, I have to say.
Well, thank you. That's very kind of you.
Well, I know it is a solution to the healthcare crisis. I know, I mean, for sure. But I mean, this is so much more. I'm at a loss myself at what would.
Well, you know what we'll do? We'll do this again.
Okay.
We will do. I promise you, I'll be happy to do this again. You know, I have fun doing this stuff.
Well, we have fun listening to you, Joe. This has been fantastic. Thank you again for making the time to do this. And
absolutely, David. Thank you for the opportunity. I had a great time doing it, and I hope we you get a lot of phone calls from it because this is going to be a big deal. Plus, when you guys see the fulfillment book you get, oh my gosh, it's gorgeous. It shows what all the networks and services you get are. You're going to be amazed. We only scratched the surface tonight.
And someone is asking in disbelief, I guess. She's saying, are these real MDs that we have?
Yes, they are real MDs. In fact, feel free to go to the Wellness Shield website. You can get there through the secure.wellnessshield.com/rep/Dr. David, and then click on the Wellness Shield logo down in the page, and it will take you into our primary site. And then click on the providers, and you can do a lookup, and you can do the doctor lookup, and type in what kind of providers you're looking for. Do the it'll ask you what you're looking for and tell that, and then put in your zip code and see. You'll find doctors in your area who do what you do. I will tell you this: we have one of our agents who had a mild heart attack, and he sees a cardiologist on a regular basis. And he is an insurance agent who found out about us through his master general associate or agent, and so he signed up with us, and he had gone to his cardiologist and said, hey, look, what would you charge me? What would be the cash price if I just paid you cash for, my checkup with you? And the cardiologist said, oh, the regular cash price, that'd be $175 per visit. So he joined us to sell, okay, but he became a member, and he called up PHCS, and they called to verify that the doctor was in the PHCS, and what the discount was, $75. Saved $100 per visit.
Wow.
Those are real savings, man.
Absolutely.
$100 a pop. He's thrilled.
Mm-hmm.
He was amazed. We had another one of our agents who's diabetic, and he said, Joe, I paid one of the pharmacies that's in our network. I pay them for their plan that guarantees me the lowest possible price. So I don't think your discount plan is going to beat theirs because they guarantee it. And I was like, okay, well, but you've got the plan anyway. But do me a favor, next time you go for your monthly stuff, just find out if what their price is, what our price is. I'd be interested to know. A week later, he comes back and says, Joe, I owe you an apology. I went and their card that I pay them for, that they guarantee me gives me the lowest price, the Wellness Shield price beat it by $20, not 20 cents, not $2, $20. That's $20 a month for his monthly supplies. That's $120 a year that we beat them. And the little girl there at the counter, the pharmacy tech, she goes, oh, well, we'll match that price. He says, no, you don't understand. You are the pharmacy, and you charged me for a program that you guaranteed me gives me the lowest price, and I just beat it by $20. Your guarantee is worthless.
Right.
Okay? You are the pharmacy. You know what the prices are. And I just beat it. Your guarantee is worthless. I want a refund on my, quote, discount membership. And he came back, I owe you an apology, Joe. You didn't just beat him by a little bit. You beat him by $20.
Wow. Wow.
Yeah.
Wow. Well, you guys are poised to do a lot of good stuff in this country.
Well, we're working on it. We are really working on it, and I hope that everybody will give us a call in the next few days. We can get them set up, and like I said, anybody who's interested in having a little bit of extra income can check that out, and I'll be happy to help everyone that I can with that. David, I really appreciate the opportunity to be on the call, and we'll set up a time to do this again. And in fact, anybody who wants to tell David what they thought about tonight's webinar, we can use that to promote the next one.
Yes,
and
please.
Anybody who becomes an agent can then use the next one to promote, their
right.
business.
Absolutely.
So,
absolutely.
So anyway.
And that has been our dream as well, to help people also spread the word about great products and great services, and get some reimbursement for that as well. Hopefully some large reimbursements. So yes, indeed, we need to promote this hardware.
Boy, David, I can't tell you how much I enjoyed doing this.
Yep.
I hope everybody, I understand that there are people who don't believe it's real. I want you to notice on there that we are regulated by the Texas Department of Insurance, and we even have all of the information for all the states on here in our disclaimers. Feel free to call Carrington to verify that we're real. Feel free to call us. Feel free to call the Texas Department of Insurance. We're real.
Okay, well, there you go, folks. There you go. You're free to check it out. All right. Well, this wraps. We need to wrap up this very, very informative and very, very helpful webinar. Thank you again, Joe.
My pleasure entirely, David. Thank you.
We'll chat soon. Thank you, folks, for joining us.
Sir. Thank you all.
Thank you for joining us, and God bless, and we'll see you soon. We have some nice webinars lined up for you next week, I believe. So take care. God bless. Bye.
Bye-bye.